Okay, good afternoon, viewers, and welcome. Today, Clayton County Library System is recognizing National Women's Health Week, which runs from May 9th to the 15th. Before I introduce our guests, I'd like to promote two of our main titles here at the library. The first book, Health, the Black Woman's Wellness Guide, written by Eleanor Hinton Hoyt and Beard. It focuses on prevention and awareness across generations and circumstances and explore Black women's top 10 health risks, including heart disease, cancer, obesity, and violence. The second book is entitled A New Prescription for Women's Health, Getting the Best of Medical Care in a Man's World, written by Dr. Bernadine Healy. This book highlights the 10 major health challenges women face from childhood to old age. It dives into the causes, treatment, and preventative measures for conditions most likely to affect women. Either of these titles and so many others that are related to this topic can be checked out from the Clayton County Library System. Today, we have invited Ms. Jenny Wilson from the Clayton County Health District to help us present the topic on women's health. Ms. Jenna Wilson is a high school graduate and a resident of Clayton County. She has a master's in nursing with a concentration in public health administration from the University of South Carolina. She has held the position as a child health immunization coordinator before entering her current title as district nursing and clinical director for Clayton County. We welcome her expertise on the topic of a healthy feminine me. Ms. McWilson, welcome.
Thank you. And I'm going to go ahead and share my screen.
And while you do that, I'll encourage our audience to post their questions in the chat if there are any questions, and we'll get them answered at the end of the presentation.
Okay, I'm just trying to start my PowerPoint. Hold on. And I'm gonna see, Dana, is there a way, can you start my PowerPoint? Okay. All right, thank you so much. You can give, if you can give me control back, then I can move on. All right, good afternoon, everyone. I just want to thank Clayton County Library for this opportunity to provide education on the topic of women's health. May is Women's Health Month, and for the week, May 9th through 15th, we are celebrating National Women's Health Week. So this is an opportunity to make sure women are informed, educated, and know how to find the resources to stay healthy. Once again, my name is Janet McWilson, Clinical Nursing Director here at Clayton County Health District, working at our health department. And here we do provide services to women. We also educate our community about the importance of prevention and also chronic health diseases. And I'll get into some more of the services that we provide a little later in my presentation. But for today, our objectives are to discuss the importance of women's health. I will also talk about some of the regular medical checkups that women should do throughout their lifetime, and then also mention some ways to improve your health. All right, so the importance of women's health. Women's health refers to the branch of medicine that focuses on the treatment and diagnosis of diseases and conditions that affect women's physical and emotional well-being. So we have to remember not just our physical bodies are affected, our heart, our lungs, also emotionally we're affected. So we have to take care of ourselves physically as well as emotionally. As women, we do a lot. We are nurturers. We take care of our families. Some of us have small children, and some of us have adult children. Some of us are taking care of parents or loved ones that need assistance. And we all have different aspects of our lives and how we live daily, and just what our lives consist of. Some of us have underlying conditions that we have to live with and control, on top of all the other stressors that we live with. Women should make their health a priority and take care of themselves. It's extremely important that all women and girls, especially the ones that are living with underlying health conditions like your hypertension, diabetes, obesity. Some of us have heart problems, respiratory problems. And also our older women, we need to make sure that we're starting to take care of our health now. We always talk about prevention being key, but also maintenance and being in control of our lives is key as well. I did want to talk about some of the leading causes of death in women. And number one, we have heart disease. Heart disease is the number one killer of our African-American women and also white women in the United States. Number two, we have cancer. And some of the cancers that fall under this heading that affect women are breast cancer, colorectal cancer, endometrial cancer, lung cancer, cervical cancer, skin cancer, and ovarian cancer. So there are a number of cancers that can affect women and that also, cause our death. Number three, we have chronic lower respiratory diseases, and that makes up your asthma, your chronic obstructive pulmonary disease or COPD. A lot of women with COPD might have to use oxygen. And then lung cancer, and then sleep apnea. And then number four being stroke. And as we go through some of the preventative screenings and treatments, you all will hear of ways to possibly ward off some of these diseases. Although some of them, if we have a family history, we're more prone, but there are things that we can do in our lives that can help us so that we aren't coming down with these diseases. All right, so women's health includes a wide range of specialties and focus areas. And so we'll talk about a few of these on this list. But I do want to start out talking about birth control, which is important. It does assist with family planning. It helps with us spacing out pregnancies, which helps a woman's body recover. As you all know, pregnancy puts a lot of strain on a woman's body. And it's important that we give our bodies time to recover. So that's the good thing with family planning and birth control. We can kind of, space them out and know when we might want to start having another baby. just so that we can keep ourselves healthy and not just our bodies, again, emotionally and mentally. STI, sexually transmitted infections. We want to make sure we're getting checked and getting tested. Two of the sexually transmitted infections and your gonorrhea, they can be present in the body and you don't have any outward signs and symptoms. And left untreated, these can cause infertility. So a woman will be unable to have a baby when she is ready. STI screening, usually annually, we should get that done up until the age of 25 or whenever needed. And then your women who are 25 years and older, you should be screened if you're going to the doctor and you just request it. They should do that testing for you. If you're at high risk, which includes having more than one sexual partner or unsafe sex practices, you should be tested or checked. Depending on the lifestyle, you do want to make sure there are, many other sexual transmitted infections. So your syphilis and HIV, you also want to make sure you're tested against those as well. So like I said, a lot of these other things, breast cancer, mammograms, women and heart disease, we're going to go through those and we're going to talk about prevention. All right, so preventative health screenings, and that's just what it says, prevention, preventing these things. And first we'll talk about breast health. So we should all be doing our breast self-exams, which we should be performing these monthly. Women of all ages should be familiar with their breasts so they can discuss any changes with your healthcare provider. A breast exam by a medical professional is usually done every 3 years, especially for your women less than 40, and then yearly for your women over the age of 40. Now your mammograms every 1 to 2 years beginning at age 40 for women with average risk to breast cancer. So if you have maybe a family history or you've had previous issues with your breast, your physician might start earlier with you having your annual breast screenings, exams, and then your mammograms. So that's why it's good to communicate with your healthcare provider so they know what's going on, so they can make those arrangements to make sure that you're on the right path and getting screened when you need to. Your mammograms help detect that early breast cancer. A mammogram can usually find lumps 2 or 3 years before a woman or her primary care provider can feel them. So that's very important, making sure we're keeping up with those screenings. Regular screenings have proven to show a 25% reduction in deaths from breast cancer. So think about it, a woman doesn't have to show any signs and symptoms, but just making sure that she's taking that initiative to go every year to get that exam can put her in a better place. All right, next we'll talk about our reproductive health. So your pelvic exam should be performed annually throughout your life. And this can also assist your healthcare provider with finding various vaginal and cervical conditions like cancer, sexually transmitted diseases, any fibroids or cysts. Because when they're doing that pelvic exam, they're going in, they're visually examining, and then they're also feeling, so they can feel for any masses or lumps within that area. Your Pap test or Pap smear looks for signs of cervical cancer. Women 21 years of age and older should have an exam every 3 years. That period can be extended for older women, but it's based on your doctor's recommendations. So again, that's why it's good to make sure you make those appointments. Keep in communication with your healthcare provider, because the more they know about your history, the more they can make sure you're on the right track and getting those Pap tests when you need them. STI exams and labs, like we talked about previously, those can be done prior to sexual intercourse with a new partner. That's good because you always want to know exactly what's going on with your body, when you might have acquired different diseases, and also want to make sure you're including that HIV testing in with those other sexually transmitted disease tests that you're getting. We also now have the HPV vaccine, which is available for women up to the age of 26. It is a series, depending on when you get it. It could be 2 or 3 series shot, but it does also protect against certain strains of cervical cancer. And we'll talk about some immunizations a little later on. All right, so heart health. We do want to make sure that we're getting our blood pressure taken. At least check at least every 2 years. If you're going to that doctor getting that annual checkup, it's going to be checked more, of course. And then if you've already got problems with blood pressure or high blood pressure, you're going to the doctor more often and getting that checked. High blood pressure can lead to a variety of health problems, including heart attack, heart failure, stroke, kidney disease, and also dementia. As we mentioned before, heart disease is the #1 killer of women. And just want to mention signs of a heart attack in a woman. So I know you all probably heard that sometimes a woman can experience signs of a heart attack, but they're not your typical symptoms. She might feel fatigued. She might have some nausea, some sweating, but these are things that happen every day, right? And so this might delay her from seeking medical care. So again, that's why it's good to know these signs, and also good to make sure we're keeping track of our numbers and know where we are. Having the cholesterol panel done at least every 5 years as well, knowing our total cholesterol and knowing our nutrition status and where we stand, because that cholesterol can play a really important role in your heart health with heart disease as well as stroke. And it's also important to know that women who suffer with gestational diabetes, preeclampsia, or you had high blood pressure during pregnancy, that can be a sign of any future heart problems. So you always want to keep that in mind. So with heart health, some things we want to make sure we're doing, eating healthy, because that has significant benefits heart-wise, making sure we're eating the right things, our fruits and vegetables, and not always our fried foods and burgers and things like that. We want to make sure we're preventing diabetes and keeping our glucose under control. Smoking is a big factor with heart disease, stroke. So we want to make sure we're trying to cut out smoking if we can, do smoking cessation programs so that we can limit that effect on us. Especially regular physical activity, making sure we're reducing that time that we're sitting and just being sedentary and not, working our bodies, because that can contribute to us developing these diseases. Physical activity can help lower that blood pressure, help improve that glucose so that we're controlling our diabetes or not even developing diabetes. And then also helping with that cholesterol and good benefit with weight loss. All right, some additional screenings that we should always get done. Eye exams should be done every 2 years or more. A yearly eye exam is recommended if you have diabetes, because that can play a part into your vision. Diabetes does affect your vision, so making sure you're staying on top of that and getting those screenings when you should. A little bit about diabetes. Diabetes does affect your body's ability, again, to produce or use insulin. And diabetes can cause other complications like heart disease, or stroke, or kidney damage. Early detection and treatment of diabetes is important to keeping women healthy and then helping to reduce the risk of serious complications down the line. And we talked a little bit earlier about family history of diseases. So it's very important, if you do have a family history and know people in your family that suffer from diabetes, you start watching your diet. You get an exercise routine, and you make sure you stay on regular checkups, because those are ways that you can, help prevent or make sure you're on the right track so that you don't develop diabetes if you can help it. Colon cancer screening. Again, if you have a strong family history of colon cancer or polyps, or if you suffer yourself from irritable bowel or polyps, it's important to make sure that you have that screening completed as well. All right, so we talked about making sure that we're getting our yearly checkups. And with your well woman exams, with some of the things that we talked about, preventative screenings before, this in addition are some things that will probably be brought up during your exam session with your healthcare provider. So depression and stress, those are things that we need to make sure that we keep an eye on, because stress is a major factor in developing those diseases with your heart, strokes. A lot of times people just don't know how to deal with stress. So it's very important that you discuss it with somebody and make sure that you're, getting those things in, like physical activity, maybe journaling, things to help reduce stress. We talked about birth control, making sure we're, spreading out those pregnancies, helping to make sure that your body stays strong. Menopause and osteoporosis. So osteoporosis is when your bone strength weakens and you're more susceptible to fractures. And women are prone to this because of menopause. Women have a lot of hormones in their body, but during menopause, that estrogen decreases. And so that's what causes that bone loss. So we have to be careful. Medical and family history is very important during your exam as well. So I know we go to the doctor, we're getting asked a lot of questions, but it's important that we're truthful in our questions and being honest and making sure we're providing that information so the doctor can know exactly how to help us when we need to go get those breast exams, how often we need to have a pelvic exam or the pap smear, making sure we're staying on top of all of that. And just know that those little tests we do, height and weight, give a lot of information, can tell us if we're obese, if we're putting the right things in our body nutrition-wise. And then that body mass index can tell us a lot as well. Your pulse rate can tell a lot about your heart health, and then blood pressure as well. All right, so we said we would come back to immunizations. There are immunizations that we do need annually: a flu vaccine, your tetanus or your Tdap vaccine every 10 years. We should make sure we stay on top of that. Women should make sure, especially of childbearing age, that we've had our varicella and MMR, because if you do come down with these diseases once you're pregnant, it is harmful for the baby. So that preconception counseling, getting counseled prior to, that planning for the baby, making sure that you have these immunizations in place. The pneumococcal vaccine for pneumonia. A lot of times if people have pre-existing conditions like your diabetes, they will want you to have the pneumonia vaccine to help you. And of course, anybody over the age of 65 should be vaccinated against your pneumonia. Shingles vaccine for people over the age of 50. Should make sure you're vaccinated against that. And then we mentioned before your HPV vaccine, and that can be for ages 9 to 26. It is recommended for 11 to 12 years old, and when you're younger, you can get the 2 doses. Pretty much over the age of, let's say it's 13 or 15, it is 3 doses. So that's why it's better to get that when you're younger. But up until the age of 26, that HPV vaccine is recommended. And of course, now we still want to make sure we're protecting ourselves from COVID. So that COVID vaccine as well is available. All right, so steps to take for better health. So we want to maintain a healthy weight. Of course, weight plays into a lot of different diseases. You have a lot of weight on you, your heart has to work harder. Your lungs have to work harder. So making sure we're maintaining a healthy weight. Getting physical activity, 30 minutes of physical activity daily will help. Right now in the time we're living in, there are a lot of virtual exercise programs that are very convenient that we can, go online and do. So it's very important that we're getting that physical activity in our lives. Staying active, making sure we're eating well-balanced meals and snacks, eating those vegetables, make sure we're decreasing our sugar intake and taking a daily multivitamin. Taking care of your physical and mental health. You want to make sure you're talking with family and friends. Again, we've been quarantined for almost over a year now. People haven't been able to go out, visit friends and family. So we want to make sure that, you have somebody you can go to, somebody you can talk to about things, and do things that you enjoy. It's good for your mental health. Practicing good sleep habits. Making sure you get at least 7 hours of sleep a night and having good bed routines. Just making sure you're doing something to wind down your mind and your body so that you can get good rest. And then making sure you have healthy ways to manage your stress. Again, physical activity, journaling, sewing, just different things that you can do to relieve stress and just get your mind off of the daily. Quit smoking. You want to look out for your lungs. You want healthy lungs. And then again, time of COVID, make sure we're wearing our masks, social distancing, and then practicing good hand hygiene. And again, getting vaccinated. All right, so I did say I was going to talk about some of the services that we offer for women at Clayton County Health District. So we do have our breast and cervical cancer program, or BCCP. And with this program, we do offer screenings, clinical breast exams, pelvic exams, Pap tests, mammograms. We do follow referrals for those mammograms as well. And then if a woman has any issues or findings, we will refer her. We do blood pressure screenings and weight evaluation. And our breast cancer screenings are provided for women ages 40 to 64. And then cervical cancer screenings provided for women aged 21 to 64. And our services are provided, they're low or no cost to our Georgia residents and who might be low income, uninsured, or underinsured. And if you do not fall within those age ranges, but you have issues or need to be checked out, there's no problem. We can work around that. So we just don't want you, holding those screenings off, especially if you have issues. We want to get those addressed and see what we can do about that. We also have our family planning program. We offer your well women exams as well. So you kind of get that annual screening. Birth control options. We do give condoms. We have birth control. We also have your IUDs and implants that women can get, and those stay in for your extended period of time. We also have our immunization department. So we do offer those immunizations that we discussed in the previous slide. And the number down to call our clinic for any appointments is down at the bottom of this screen. And again, I just want to thank you all for joining, and thank Clayton County Library System again for having me and letting me present during our Women's Health Week. And thank you.
Okay, thank you, Ms. Jenna. I'm not seeing any questions in the chat, but for those of you who have joined us today, and those of you who would probably be looking at this presentation at a time convenient for you, I have dropped some resources in the chat. I hope that you find them very useful, and I hope that today you've learned something new. Have a great day, and again, thank you, Ms. Jenna.
Thank you.